Hi Dr. V, it's Kylie, and today I'm doing my ECG prep video. So in order to start the prep for the ECG, you need to get ready the areas where the electrodes are going to go. In order to do this, you want to get like a cotton ball or just a cotton pad covered in alcohol, or like an alcohol wipe, just to wipe down those different areas where the electrodes will go. And what this does is it just cleans the area and gets rid of oils or anything else that may be on the skin. Next, you want to get an abrasive pad of some sort, like gauze, and just lightly rub the areas that you just cleaned. One, because it dries it, and two, it wipes away and clears away the dead skin cells on those areas. And then the third part is kind of optional. It depends if your client has a lot of like chest hair or body hair where the electrodes are going to go, then you want to shave those areas. And what all of this does, the shaving and the wiping down and the abrasing, it gets rid of possible noise and artifacts that may show up on the ECG strip when you're looking at it. And what an artifact is kind of chaotic lines or bumps in the ECG that make it hard to read. So once you've done all of that, you're going to start with your 4 limb leads. So first is the right arm lead. So can you see a little bit? Sorry. And what you're going to do is you're going to feel for the clavicle, and you're going to find the whole clavicle, find the mid-clavicular line about right here, and then you're going to place the first electrode right underneath the bone. I'm using these little sticky notes. Right underneath the bone. Okay, the next one's going to be on the left side. So again, the clavicle, find the mid-clavicular line right here, and you're going to place the next one right there. Then you have the left leg lead, and that is also in the mid-clavicular line. So you're just going to trace down, and it's right underneath the last palpable rib, which is right here. And while you're doing these, you want to make sure that you're not placing them on bone or like a bunch of muscle or fat tissue, because that can also create noise or artifacts on the ECG reading, because it kind of blocks the signals. So you want to make sure you get it on the tissue, not the bone. Same thing, the right leg lead, straight down mid-clavicular line, feel for the last palpable rib right here, and that'll go there. Okay, and then we have 6 more, and these are our just chest leads. They're called like V1, V2, V3, V4, V5, and V6. So V1 is going to go on the right border of the sternum in the 4th intercostal space. So it'll be on this side of the sternum, and you just feel for like the intercostal spaces, which is the areas between the ribs, and then place the electrode right there as close to the middle as you can without getting on the sternum. An easy way to also see this is it's kind of like at the nipple line. Sorry, my phone about died right there. It's about on the nipple line right there. So number 2, V2, will be the same area, but on the left side of the sternum. So it'd be right there. Now we're going to skip V3, and we're going to go to V4. So V4 is also in the mid-clavicular line in the 5th intercostal space. So if that's 4, you just feel for the next one, 5, and you just kind of trace it to here, which is kind of like it's kind of behind his pec, but you don't want to put it on all of that muscle tissue because it can block the signals, like I said earlier, so just do it a little below, as close as you can. That's 4. Then you'll go back to number 3, and number 3 is just diagonal between V2 and V4. So you just go here, right in between, right there. Okay, and number 5 is going to be on the anterior mid-axillary line. So right here, and you're just going to go straight down, and it is going to be in the 5th intercostal space as well. Go ahead and keep your arm. You can relax it. There you go. So that's 5, and just trace it to right here, where it's on that line. And then the next one, the final one, is 6, and it's going to go in the mid-articular line, like on the side of the body, also in that 5th intercostal space. So just keep tracing. It'll go right here. If you want to turn real quick and show, right there. Okay, so whenever you're doing this one, you want to make sure that your client doesn't raise his arm above his head or up. He wants to either like rest it on you or on a surface, or just have his arm down. Because whenever he raises his arm, it moves that skin. So whenever you place the electrode and then you relax, your skin's going to like move back to where it was, and it could not be in the right place. So you want to be as relaxed as possible when you do this. So once they have all the electrodes on, you're going to take the leads, or the wires that connect to the ECG, and they are all labeled. They'll have a RAL for right arm lead. That'll go right here. And then LAL, RLL for right leg lead, and then LL for the left leg lead, and then the other 6 will have a V1 through V6 on them, and you just connect them onto the corresponding ones. After that, you just turn the ECG on, and it'll start showing the heartbeat. If it's saying error, you probably just have 2 wires switched. Once you switch them, then it'll start working, and you just kind of look at it. If it looks fine, then that's great. But if you see something that's a little off about it, maybe the rhythm of it, or you think you see an abnormality, even if you're not even sure, it wouldn't hurt to just print it off, and it will print off just a static sheet of the reading, a static reading. And then after that, then you can just unhook the wires and peel the electrodes off. Thanks.